Hi, my name is Erica. I'm a nurse practitioner student at UTEP, and today I'll be conducting a head, eyes, ears, nose, and throat, as well as a mini mental health examination on Natalia here. So we're looking at the hair, we're also looking at the scalp, we're looking at the skull. We see that she has normal quantity, normal distribution. It's in a cute little bun. If I inspect inside, we don't see any lesions, there's no lice, and her head is normal cephalic. Do you feel any tenderness when I touch your head?
No.
No? Okay. Next, I'm going to inspect the skin of the head and the face. We see no edema, no lesions. She's very moisturized as well. Next, I'm going to palpate the cervical lymph nodes. So we'll start here at the top, come down to the bottom, here as well. And these are all non-palpable. Next, we're going to examine the trachea. So here we see that it's midline, it's not deviated. I'm going to go ahead and take a listen to the trachea really quick. Go ahead and breathe normal for me. Okay, normal clear breath sounds. Next, we're going to assess the thyroid. I'm going to do that again from the back, okay? So you just sit normal for me. Okay, no edema, no swelling, no goiter noted. So for the next part of the exam, we're going to test the eyes. First, we're going to start with visual acuity. So we'll be using a Snellen chart that is here to the left. So if you go ahead and stand for me. Perfect. Yes, and we'll remove your glasses just so we can get an accurate assessment. So go ahead and cover your left eye. So we're testing the visual acuity of the right. I want you to go ahead and read. Can you read this line for me?
FPH.
Okay, and this one?
OLCF.
Okay, and then this one here?
DHJEBS.
E or B?
It's a B.
Okay, next one?
EFTEO.
Okay, so your visual acuity on the right side is going to be 20/40. Okay? So let's try the left side. So you're going to cover the right. Let's start here at this one.
DHJEF.
Okay, let's go up.
DLCF.
Okay, and come up to this one.
Oh no, FPH.
Okay, so for the left side, you're going to be at a 20/70 compared to the right, which is at 20/40. That's totally okay. So we're going to do a visual field finger wiggle test. That's just to test confrontation. So whenever you see my fingers wiggle, you go ahead and let me know. Okay, so we're going to start here. You see anything? This side? Okay, go over here. Over here. Okay, perfect. Next, we're going to look at the position and the alignment of the eyes. Again, total inspection. Eyes are not protruding and they are aligned equally on both sides. Next, we're going to inspect the eyebrows. We'll inspect the eyelashes. We'll inspect the eyelids. And then we'll go from there. We see that the eyebrows are again aligned. Eyelashes on both sides are full. They're clean. There's no edema on any part of the eye whatsoever. So next, we're going to assess the lacrimal apparatus as well as the sclera and the conjunctiva. So that's just going to pull down here on your eyelids. So that's normal. There's no dryness, no tearing. The conjunctiva is pink. The sclera is white. No signs of edema. We'll keep your glasses off. Next, we're going to inspect the cornea, the iris, and the lens. We'll use this with an ophthalmoscope. And then go from there. Just take a look at me. There's no opacities as well. We can also take a look at the pupils. We see that they're equal, round, reactive to light. They start at a 4 and they end at a 2 when light comes in. They also accommodate as well. So next we're going to use the ophthalmoscope one more time to check the optic disc. We're going to look at your retina and again the retinal vessels, okay? Go down to 0. Okay, the red light reflex is present in both. No opacities, no lesions. The disc margins are also very sharp, and the retinal vessels. Inspect and look at the ears. So we're going to look at the outside, the auricle, the surrounding tissue. Everything looks relatively normal. There's no deformities. We do have keloids on this side, which was from previous piercings, but nothing super out of the ordinary. We're also going to palpate the tragus, the mastoid, the auricle as well. Do you feel any tenderness, anything like that?
Mm-mm.
Okay, perfect. Next, we're going to examine the ear canals. So I'm just going to take a quick look inside. Okay. So there's minimal wax, there's no discharge, no redness, no swelling. The same on this side. Everything looks relatively normal. I can also see the tympanic membrane, which is pearly gray in color. It's translucent, there's no bulging. We'll take a look again on this side for the tympanic membrane. Again, same thing. Lastly, for the ears, we're going to test your auditory hearing with the whisper test, okay? So I'm going to stand a few feet behind you. You'll cover one ear. I'm going to whisper letters and numbers, and you just tell me what you hear, okay? All right, so go ahead and cover your left ear.
1, B, C.
Okay, perfect.
4, D, H.
Okay, awesome. So now because there's no hearing loss and you did well on the whisper test, there's no indication to test your hearing with a tuning. For the nose, what we're gonna do is we're gonna look at the outside, we're gonna look at the inside, and this is just, again, inspecting for any kind of symmetry, deformities, and tenderness. So I'm gonna go ahead and take a look on the outside, relatively normal. I'm gonna go up. There's no deviation. Mucosa is pink. A little bit of hair, nothing out of the ordinary. Was there any tenderness when I did that? No? Okay, fantastic. Next, we're gonna look for nasal obstructions. So I want you to close one nostril. Okay, breathe in. On the other side. Okay, was there any difference in the way that felt?
I have allergies.
A little bit of allergies. Okay, so a little bit of obstruction, but nothing super out of the ordinary. Next, we'll look again at the nasal mucosa with an otoscope. We'll look at the septum, we'll look inside, and then we'll see if there's any kind of ulcers, polyps, any kind of deviation noted, okay? All right, quick look. There's no deviation, nostrils look normal, mucosa's pink. Totally normal, okay. Lastly, we're going to palpate the frontal sinuses and the maxillary sinuses. You just let me know if there's any kind of tenderness, any fullness, any pressure that you can feel. Okay, so we'll start here. Anything there? No? Okay, what about here?
Mm-hmm.
Feel okay? Okay, now we're going to assess the mouth and the pharynx. First, we're going to inspect the lips. We see that they're pink in color. There's no ulcerations, no cracking. They're moist. We're gonna next look at the oral mucosa. So that requires me to use a tongue depressor. We're gonna open up your mouth just a smidge. Okay, again, also pink, no ulcers, no lesions. So we won't have to palpate because there's no lesions and there's no indication to do the palpation. Next will be the gingiva. Again, using the same tongue depressor, we're gonna look at the gingiva. Again, pink, no discoloration, no ulcers, no lesions. Teeth are clean. There's none missing. No issues here with the teeth. Next, we're going to inspect the gum margins and the interdental papillae. So one more time, we're looking again in the mouth. We see no ulcerations, no lesions, no swelling, no redness, no bleeding. Next, we're going to inspect the hard palate and the floor of the mouth. So you're gonna go ahead and open wide for me, look up, go ahead and look. I'm gonna touch real quick. Okay, again, no discoloration, there's no nodules, there's no deformities, no lesions, no swelling whatsoever. Next, we'll test for cranial nerve 7, which is the hypoglossal nerve. So just go ahead and stick your tongue out. And can you keep your tongue out for me? We see that it's pink, so we're gonna inspect the tongue as well. It's pink, it looks moist, You know, there's no breakage, no ulcers, nothing like that. And then because there's no lesions on the tongue as well, we're not going to palpate the tongue because of the absence of lesions. Next, we're going to inspect the soft palate, as well as the uvula, the tonsils, and the pharynx. So go ahead and open up for me. One more time. We see the soft palate in the back. There's no discoloration. We can see the uvula. This patient does in fact not have any tonsils. The pharynx is pink in color as well. Lastly, we're going to test for cranial nerve 10, which is the vagal nerve. So all you have to do is keep your tongue in your mouth, say ah, and then we'll see.
Ah.
Perfect. The uvula stays symmetrical in the back. Okay, the last part of our assessment is going to be a patient health questionnaire, which talks mainly about your mental health and how you've been feeling over the last 2 weeks, okay? And if any of these problems have bothered you in that time frame. So I'll ask you a question and then you'll respond with not at all, over several days, over more than half the days, or nearly every day, okay? So the first question is little interest or pleasure in doing things. Are you feeling that not at all, over several days, more than half the days, or nearly every day?
Several days.
Okay. Have you been feeling down, depressed, or hopeless?
Not at all.
Trouble falling or staying asleep or sleeping too much?
Not at all.
Feeling tired or having little energy? Is that over not at all, over several days, more than half the days, or nearly every day?
Several days.
Poor appetite or overeating? Is that not at all, several days, more than half the days, or nearly every day?
Not at all.
Feeling bad about yourself, or that you are a failure or have let yourself or your family down? Is that not at all, several days, more than half the days, or nearly every day?
Not at all.
Trouble concentrating on things such as reading the newspaper or watching television?
Not at all.
How about moving or speaking so slowly that other people could have noticed? Or the opposite, being so fidgety or restless that you have been moving around a lot more than normal?
Not at all.
Okay, and lastly, thoughts that you would be better off dead or hurting yourself in some way?
Not at all.
Okay. And then if we've checked off any of these problems, which we have, how difficult have these problems made it for you to do your work, take care of things at home, or get along with other people? Is that not difficult at all, somewhat difficult, very difficult, or extremely difficult?
Not difficult at all.
Okay, perfect. And that concludes our head, eyes, ears, nose, throat, and mental health assessment.